Audio Jungle.
It's March, and actually this is Ovarian Cancer Awareness Month. What I'd like to talk to you about today is ovarian cancer. In the United Kingdom, 1 in 52 women will develop ovarian cancer in their lifetime. It is a very significant disease in the population. Before going on about ovarian cancer, let's talk about the ovaries first of all. Now, the ovaries is an organ that obviously exists in women only. Women have 2 ovaries, and during childbearing age, so that's between puberty and menopause, a woman's ovary produces an egg every single month approximately. If this egg is fertilized, then pregnancy will be confirmed, and that will lead to a baby. If the egg isn't fertilized, a woman will go on and have a period for that month. This whole process is a very complex process, organized by the hormones communicating from your brain to your pituitary gland in your brain and your ovaries. And your ovaries themselves produce estrogen and progesterone, which help to coordinate the whole menstrual cycle. Now, ovarian cancer is when cells of the ovary develop abnormally and out of control, so really fast, and they form balls of cells called tumors. There are actually 6 different types of ovarian tumors that are categorized by the World Health Organization, and these are further subdivided into benign, so that's non-cancerous, or intermediate, so this is where they may be cancerous or may not be cancerous and will need further tests or follow-up, and then cancerous cells. Ovarian cancer is the 6th most common cancer in the United Kingdom. About 1 in 52 women will develop ovarian cancer throughout their lifetime, and across the world, about 240,000 women were diagnosed with ovarian cancer in 2012. In Europe alone, that was 65,000 women. In the United Kingdom, about 7,400 women are diagnosed with ovarian cancer every year. That equates to about 20 women being diagnosed with ovarian cancer every single day. Now, there are several risk factors to developing ovarian cancer. Age is one of the most significant risk factors, with a peak in the development of ovarian cancer between the age of 75 and 80 years old. Other risk factors include lifestyle. For example, we know that smoking increases your risk of ovarian cancer, but also exposure to something called asbestos, which is normally found in very old buildings, but also the use of talcum powder in the sort of lower abdomen and perineum area has been found to be associated with an increased risk of ovarian cancer. And this is thought to be due to the presence of asbestos within the talcum powder. We also know that factors that increase the number of ovulatory cycles, so that's the number of periods a woman has in their lifetime, increases their risk of ovarian cancer. So, for example, starting your period at a much earlier age than the average female population, or developing menopause at a much later age compared to the average woman. Additionally, if a woman goes through their whole lifetime without having any children, these are factors that can increase the number of period or ovulatory cycles a woman has in their lifetime, and can therefore increase your risk of ovarian cancer. Now, on the contrast, if you have a much more reduced number of ovulatory cycles, or reduced number of periods during your lifetime, that can reduce your chance of developing ovarian cancer. So, for example, starting your period later than average and developing menopause a lot earlier than average. The average age of menopause is between the age of 48 and 52. So, if you have if you develop menopause at a much earlier age, then your chances of developing ovarian cancer are reduced compared to the average population. Now, what's also significant here is pregnancy. Now, obviously, whilst a woman is pregnant, they're not ovulating, so they're not having menstrual cycles. That can reduce your chances of developing ovarian cancer. Just as in the same way, if a woman breastfeeds after giving birth, that can also be protective against developing ovarian cancer. Genetics also play a significant role in the development of ovarian cancer. Now, you may have heard of the genes BRCA1 and BRCA2, or may have heard of it in the context of the famous Hollywood actress Angelina Jolie. Now, BRCA1 and BRCA2 are famously known for their association with breast cancer, but they actually also significantly increase your risk of developing ovarian cancer. And BRCA1, for example, increases your risk somewhere in the region of 25 to 40% of developing ovarian cancer, and BRCA2 increases your risk in the region of 27% greater likelihood of developing ovarian cancer compared to the general population. Now, if you have a family member, so perhaps your mother or sister who's developed ovarian cancer in the past, then your risk of developing ovarian cancer is 3% more compared to the average population. It is also known that either a personal history, so that's if you've developed a history of certain types of cancers, or another member of your family has developed one of these cancers, then your chance of developing ovarian cancer increase compared to the average population. So these include cancers such as breast cancer, prostate cancer. So a woman might have a male relative who's developed prostate cancer, liver cancer, and melanoma. Now, there's a very, very, very small risk associated with people who've had IVF, and also people who have used HRT for longer than 5 years. Let's discuss the symptoms that may possibly suggest a woman might have ovarian cancer. Now, any woman can develop ovarian cancer, but it is especially more likely if you're over the age of 50 years old. And these symptoms are symptoms that can be because of a whole host of other medical reasons. So just because you have them doesn't mean you've got ovarian cancer. But if you've got several of these and they're not going away, it is definitely worth seeking further advice. And these symptoms include, abdominal bloating, or an abnormal vaginal bleeding, maybe perhaps a post-menopausal bleeding. Some women may develop low abdominal pain or pelvic pain that's persistent and not going away. Now, other symptoms include, malaise, significant fatigue, weight loss, and lethargy. Some women may also develop nausea and vomiting, or abdominal pain. And if the cancer has spread to the lungs, then you may also develop breathlessness, and that is because the cancer can cause fluid to build up in the lungs. So there are several symptoms. These are not an extensive sort of list of them. The key thing always is, if you've got a symptom that's not going away and it's causing you concern and bothering you, it's always worth seeking medical advice. When you present to your doctor will go through a detailed history, trying to find out whether you have any of the above symptoms that I've mentioned, whether you have any of the risk factors that I've mentioned, such as family history or exposure to asbestos in the past. And they'll go through your, whether you had children in the past or breastfed, a whole host of questions. So try and risk stratify on an individual basis, so they can give you an advice that is tailor-made for you. Okay. Now, they will also examine you, have a feel of your tummy and examine your pelvis. Now, depending on your symptoms and the examination findings, they may decide to go on and do a blood test. And this is usually done if the examination finding is normal. It's a blood test called CA125, which is a marker of ovarian cancer. But there are also several other things that can cause CA125 that's worth bearing in mind, such as something called endometriosis, or pelvic inflammatory disease. Other types of cancers can also cause a rise in CA125, such as pancreatic cancer, liver cancer, and lung cancer. So having a rise in CA125 does not necessarily mean you've got ovarian cancer. In fact, it can also be slightly raised in normal circumstances. Now, if there is an abnormal pelvic finding, such as finding a pelvic mass in a woman who's not previously known to have fibroids, for example, that would usually necessitate an urgent referral to a gynecologist to really further look into whether or not you may have underlying pelvic malignancy, pelvic cancer, including ovarian cancer. If the pelvic examination and abdominal examination is normal, then you may well be referred to have an ultrasound scan first, in the first instance. But like I mentioned earlier, several underlying medical conditions can cause one or more of these symptoms. So your doctor will tailor the investigations depending on what is summarized to be the various underlying possible medical conditions that may be causing your symptoms. When the symptoms that you present with, the examination findings, and all the investigations, so that's the blood test here, 125, and the ultrasound scan of your abdomen and pelvis, when these suggest the likelihood of ovarian cancer, it is really important that you're referred urgently. In the United Kingdom, we have something called an urgent cancer referral pathway, or a 2-week wait pathway, and it really does what the name suggests. That is for you to get seen by a team of specialists within 2 weeks, so investigate you really quickly and get to a conclusion as to whether you have underlying cancer, in this case ovarian cancer. That's really important because it is the earlier the diagnosis can be made, the earlier treatment can be started. Now, if you're confirmed to have ovarian cancer, then the treatment will include a combination of either chemotherapy, so that's medications, or radiotherapy, or surgery, or a combination of any of these. And the exact management in your case will depend on the type of ovarian cancer that you have and how extensive the cancer is, so that's staging. I'll mention something about this shortly. And also your underlying health conditions that you may have, you know, how physically fit and well you are at the time of diagnosis. Now, of significance also is your wish as a patient. So they will go through the risk and pros and cons of the various treatment options, and will come to a conclusion with you, depending on what you feel comfortable doing as well. I want to talk about the prognosis. So this is what's likely to happen to a woman in the months and years after diagnosis of ovarian cancer. But before going on about this, let's talk about staging. The stage of a woman's ovarian cancer tells you how extensive the cancer is, and you have 4 stages. So stage 1 is when the cancer is wholly within the ovaries. Okay, stage 2 is when the cancer has gone a little bit beyond the ovaries and is affecting other organs in your pelvis, in the woman's pelvis. So, for example, your fallopian tubes, the bladder, etc. Now, stage 3 is when the ovarian cancer has moved beyond the pelvic organs and into local or regional lymph glands. So you have a big artery called your aorta that takes blood down to your abdomen and your legs, and there are lymph glands around there. If any of those lymph glands are found to have ovarian cancer cells, then this is known as stage 3. Now, stage 4 is when the cancer has spread to more distant organs. So, for example, your lungs. I mentioned earlier that in your lungs it can cause fluid to build up in the pleural spaces, which we call pleural fluid, and that can cause breathlessness. But it may also spread to your liver or your spleen, or even your sort of more widespread in your intra-abdominal region, a sort of a layer of tissue within your abdomen known as your peritoneum. So that's stage 4. Now, 50% of women have stage 3 or 4 disease at diagnosis. So it is really, really important to be sensitive to your symptoms, to know your body well, and present early, because the earlier you present, the sooner the process of investigation can be started if your doctor thinks your symptoms are due to ovarian cancer, and the earlier diagnosis can be made, because diagnosing ovarian cancer at an early stage has a significant impact in terms of your outcome in the months and years ahead. Now let's look at, for example, survival 1 year after diagnosis. If you present at stage 1, there's a 99% chance of survival at 1 year, compared to if you present at stage 4, when there's approximately 50% chance of survival 1 year from diagnosis. Now, what about survival 5 years down the line? Again, if you present at stage 1, you have a 90% chance of survival to 5 years or beyond. But if you present at stage 4, your chance of survival at 5 years is significantly reduced to 4%. Taken as a whole, the survival from ovarian cancer has increased, in fact, almost doubled compared to the 1970s. So in the 70s, survival was less than 20% at 10 years. And now, over 35% of women are surviving ovarian cancer 10 years or longer. Now, as promised, I'm now going to give you some health mastery tips around ovarian cancer. Now, it is, first of all, really important to know your body, to know what is normal and what's not normal for you. What is your normal menstrual cycle pattern? Or have you passed the menopause and no longer having a period? You know, if you suddenly then develop a period, then that's a cause for concern. Do you normally get pain when you develop period, or is it something that's new and a more recent phenomenon? Okay, so know your body and know what's abnormal. And if you're developing things that are new and abnormal and they're causing you concerns, then it's worth speaking to a doctor and getting a second opinion. Now, the other thing that I always also say to my patients is, be honest. Now, what I mean by that is be honest about what your concerns are. We will do our best, and I always try and really get to the bottom of what brought my patient to me today. Okay, not just the symptom, but what else is going on in their mind? What is their concern? Because sometimes, unless we actually address the patient's concern, it doesn't matter what reassurance we give them, they may leave unsatisfied. And you can help in that process. So try and get across to your doctor, your GP. What is your main concern? Now, are you concerned about ovarian cancer, or are you just worried about the fact that you've got these new symptoms? Okay. Now, the other thing also is know your family history. Who's had ovarian cancer or other cancers in your family? And be prepared to openly discuss this. Now, I know for some women this isn't possible. You know, for example, if a woman was adopted, they may not know their family history so well, or at all for that matter. And then finally, now, when you go into a GP consultation, certainly in the UK where there is often limited time, although I always say to my patients, look, don't watch the clock, just let's focus on you now, and I'll give you the best time that you deserve to address your problems, okay? But what would help is perhaps have your list of symptoms written down, okay? Have your points written down so that you don't forget in the midst of the discussion with your doctor to mention something that was perhaps quite important to you. I just want to say a huge thank you to you, and well done for taking the time and investing your time in your health, because your health is your wealth, and your health is important not just to you but to your loved ones. Do make suggestions about future topics that you'd like us to discuss. You know, was there anything that particularly stood out for you today? Was there an aha moment? You know, share it in the comments, because that might just be the light bulb moment for another patient. Okay, I look forward to seeing you at our next video. Until next time, look after yourself and good luck on your journey towards becoming a master of your own health.